6:36 right now. Well, 1 in 8 women is diagnosed with breast cancer, and many women and men may have an inherited predisposition to getting this disease.
That's right, Art. I spoke to a previvor and a genetic specialist about the importance of testing and what people with breast cancer in their family can do to avoid getting it in the first place. Sarah Brown has 5 generations of breast cancer in her family. Every single woman on her mother's side has been diagnosed, and her mom is the only survivor.
Once I hit about 30, I was not looking forward to my birthdays anymore. Every year I had a birthday, I was convinced that was going to be the year that I would be diagnosed with breast cancer. About
5 to 10% of breast cancer is hereditary or due to inherited cancer syndromes, and about 70% of that 10% is due to BRCA1 or BRCA2 genes.
What we look for is patterns in the family to see if there's earlier onset breast cancers throughout one or the other side of the family. So it could come from the mother's side, it could come from the father's side.
Sarah has a 5-year-old son and an 11-year-old daughter and has been upfront and honest with them about their family history and her choice to have a prophylactic mastectomy, which can drastically reduce her chances of getting breast cancer.
She asked me one day, "Mommy, can I get breast cancer?" And I said, "Honey, you know, it's in our family, and you saw what Mommy did, and I'm okay." So she knows that that's an option for her.
Although some children may be at a higher risk than others of eventually being diagnosed with breast cancer, doctors do not recommend testing in young children or adolescents because they want the individual to make an informed decision. Some men and women inherit the risk of developing breast cancer and are forced with making a decision before they even get it. These previvors turn to genetic testing to reduce their risk.
The test that they do currently is you can do it via blood or you can do it via a buccal swab, which is a spit test. So they're basically taking cells from the sides of your cheeks and they send it off to this particular lab that does all of the BRCA1/2 testing in the country.
If you are tested and the results come back positive with the BRCA1 or BRCA2 gene, you have options. Taking a drug called tamoxifen for 5 years can reduce your risk of breast cancer by 50%. A prophylactic mastectomy can reduce your breast cancer risk by 90%. And a prophylactic oophorectomy, which is removal of the ovaries, can reduce your breast cancer risk by 50% as well as decrease your ovarian cancer risk.
So I think genetics not only helps you if you have a predisposition to cancer, but even the people who don't have a predisposition to breast cancer but happen to get breast cancer, the molecular targeting, when they basically map the genomic landscape of the tumor, even if you're 62, can allow them to better treat you and give you higher survival rates.
And remember, although it's not as common, men can be diagnosed with breast cancer too. For more information on genetic testing and on breast cancer, you can log on to our website, which is wctv.tv, and you can click on this story.
All right, very interesting. Thank you, Gina.
Yes.
Appreciate that story about previvors. Huh?
Previvors, and you know, you just have to remember that your family history does have a lot to do with it. So
exactly.
better to be safe than sorry.